Hi, my name is Brett Bloom, owner and founder of Longevity Physical Therapy. I want to share with you a case study with one of my favorite patients of all time, who's a phenomenal athlete and just happens to be my father. My dad is 87 years old and is 6 months after total hip replacement of his right hip. I want to share with you how we analyzed and monitored his strength and force production after his surgery. We partnered with VALD Health to use their innovative technology to be able to test my dad and not only how much force he was able to produce through each leg, but also how that compared to other men his age. So this is my dad performing the sit-to-stand analysis. Wait, let's go back. Let's give you a little history about my dad. My dad always placed an emphasis on his health and fitness. In high school, he was an all-CIF basketball and football player. Got a scholarship to go to USC, where he was a 4-year basketball player and a 3-year captain. In the 70s, my dad got into strength training, bell-bottom jeans, and some unusual hairstyles. Here I am with my sister the day that my dad got discharged from the hospital after his surgery. On testing day, I simply asked my dad to do as many squats as he could in 30 seconds while standing on the force decks, taking his measurements. Okay, now the fun part. We get to analyze his performance. He was able to squat to a pretty impressive depth, getting all the way to the chair, and he was able to produce 1,047 newtons of force. So the next question that he had is that any good? Well, that's the great part about this test is we can compare his results to other people his same age. As we look at this next slide, in the circled section, you'll notice that he tested in the 84th percentile for how much force he was able to put through his feet during a squat. This means that 6 months after hip replacement surgery, he's able to test at the top percent for his age group. One of the very interesting metrics we want to take a look at on the sit-to-stand test is the patient able to put equal weight through both legs after a joint replacement. As you notice looking at my dad's results, not only was he able to put equal weight through both legs, he was actually able to put more through his surgically repaired right leg, 17% more. This gives us a very strong indication that he's recovered all of his strength after surgery. As you can tell in this case study, utilizing force plate technology gives us data we rarely had access to previously. Specifically, it tells us how much force we can put through our feet. Also tells us how that compares to other people in our demographic, and is that force equal between legs? Research has shown the higher force patients can produce, the faster their walking speed, the increased ability to use stairs, and a decreased risk of falling. As you can tell, this strength diagnostic testing is appropriate for patients of all ages and all functional levels. If you're interested in getting tested, please reach out to Longevity Physical Therapy. I look forward to helping you.